Minister Joe Phaahla, as we reported earlier, has spent almost the entire day at Charlotte Maxeke Academic Hospital in Johannesburg. He toured the hospital to assess the state of readiness to reopen affected units. You'll remember that in April last year, the hospital was gutted by fire, caused the evacuation of hundreds of patients, and the hospital is still not up and running properly again. The Minister joins us now. Minister, so you've had a long tour and a long meeting. What has come out of the meeting?
Well, the meeting was, amongst other things, to get a briefing on the progress in as far as addressing the after effects of the fire almost a year ago, the work which is being done. But beyond that, also to get a full picture of the impact of that on the rest of the health services in and around Johannesburg, but also beyond Johannesburg, the rest of Gauteng, because as you know, Gauteng is very much interconnected. So we spent some time on the issue of Charlotte, which wasn't my first time to actually interact with the province in that regard. Maybe just in terms of that aspect, we've been working together with the province almost a month now, or just over a month, where we have agreed that national government is going to be directly involved in assisting the province in making sure that we address the matters of the repair of the damage into the hospital. So one of the things which we have agreed with the MEC, and because I've spoken to the Premier before, is to transfer the responsibility for the rehabilitation of the hospital to the national department, which will be working with an agency which we have used in other projects, which is the Development Bank of Southern Africa, because the DBSA does have an arm which deals with infrastructure. So we have now finalized that. So our unit which deals with infrastructure will be working daily directly with the Gauteng Department and with the Development Bank of Southern Africa. So this arrangement then takes over the project from the Department of Infrastructure Development of Gauteng, which we agreed that after all the time that it's been looking after, the progress has not been very good. So we want a new implementing agent to help us, yes.
So the fact, Minister, that the National Department of Health has now had to step in and take this project over from the Gauteng health authorities, is that a sign that they have failed in their duties to try and fix this hospital?
Well, I think Gauteng would be best placed, but to answer that question.
No, I think you're best placed to answer it, Minister, because ultimately it all does have to land on your desk, and you're the person who surely has to make that call.
No. I'm not getting involved because of judgment. All that I'm saying
I
is,
don't think it's an issue of judgment, Minister. I think it's an issue of accountability, which I think we all really need to hear about.
That's why I'm saying we are getting in to work with Gauteng. Gauteng is not getting out of it. Gauteng Department of Health will be involved with us. The only party which we have asked to exit is the infrastructure component of the government of Gauteng. And the Health Department of Gauteng will be working with us together with the DBSA.
So why is the infrastructure department in Gauteng being asked to step away? Is it because they have failed in what they were supposed to do?
Well, the fact of the matter is that there've been minimum progress under their guard. So we have then agreed that they need to be excused, so that our infrastructure unit, working with the Gauteng Health and the DBSA as our main infrastructure agent, should then be running the project, and they are busy working out all the time frames, yes.
All right,
and
so you've got a plan to try and speed this along. We're looking at almost a year now. I want to ask you why so little progress has been made. Earlier today, the President, speaking during Human Rights Day commemorations, said that corruption and incompetence have played a big role in the lack of service delivery. And as we know, the right to health services is a human right. It's something that is entrenched in our Bill of Rights. So I want to ask why there's been so little progress. Do you suspect corruption? Is it a case of incompetence?
Well, there's clearly lack of capacity. There's very serious capacity challenges, whether some of it may be because of corruption, that I'm not in a position here where I am to make that judgment.
Sure. Has it been ruled out, though?
There are some concerning...
Has corruption been ruled out as one of the problems? Sorry, yes?
It's possible. It's possible. I mean, for the fact that when there are other partners who have come in, the Solidarity Fund has come in, there's work which has been done. One of the areas, which is the emergency section, is almost ready, and myself and the MEC will give a full public account in the next few days. We're just trying to compare diaries and also put all the information together so that we can give a full update to the public. But just in terms of a part of what I was informed, which was very worrying today, was that the emergency unit, the emergency area, which was almost ready, then was some people got in and damaged, electrical appliances, damaged very expensive equipment when the emergency unit was actually ready to be functional. So that has been set back by almost 2 weeks.
That's astonishing.
So it does suggest that there's actually foul play. I mean, there's no doubt, because these things were already completed. Some of the very expensive equipment which were ready to be functional were simply just damaged, where nobody really, you can't even talk about theft.
Wow. Because
nobody was going to benefit. But they simply just, damaged it, cut the cables, and so on.
Minister, it's intensely frustrating to hear that for me, and I have no doubt for you and your team as well. Not just a matter of theft, but an issue of sabotage. And we've seen this coming up with Eskom, where Eskom CEO is saying, we're being sabotaged. Do you think this was a deliberate attempt to stall things at the hospital? Would it be, and if that's the case, would it be for contractors who want to leech off a broken system? What do you think's going on here?
I don't know, but the fact that it's deliberate from the pictures of some of the machines when which were ready to be commissioned and which were simply just ripped off, left in an unusable situation where we now have to go back to the suppliers and installers to come and inspect. So it's one thing if something has been removed and disappear, and that somebody possibly could have benefited by selling. But when something just gets damaged, when it's ready to be used, then it's very clear that what is the motive? I don't know. Whether it might be somebody who believes that if I can't get this job, then the public must suffer. It looks like some of the indications are that, yes.
And let's talk about patients now, because we know that the closure of this hospital has caused endless problems for people. It's such a crucial hospital. It used to be called Joburg Gen, and it really is one of the central hospitals in this province. I wonder if you can just update us on some specific unit. We've been hearing that the cardiac unit is closed. Can you confirm whether it's open or closed?
The cardiac, I know that the oncology section is functional. I didn't really get a good update, Sally, in terms of the cardiac unit. They did mention that there are some challenges, but I don't think it is completely closed, but I stand to be corrected in as far as that, I can come back to yourself and your viewers just to confirm. As I said, we are going to give a full account just in a few days' time.
Sure.
Once we have put all the information together.
I mean, yeah, it's a massive hospital with many, many units. Do you have any ballpark on when everything's going to be finished? Because there have been so many promises and so many broken promises. Say, yes, we're going to reopen, and no, we're not. You know, we've spoken to fire experts on this program who've said to us it's going to take 2 to 3 years to reopen this hospital to the proper compliance levels. Have you got any full reopening date on the table as yet?
Well, the area which I've mentioned, the emergency section, the accident and emergency area, will be ready. The time which our team did indicate was that at the very latest by middle of April, middle of next month, the accident and emergency area, and this will relieve a lot of pressure on the Helen Joseph Hospital, and also relieve a lot of pressure on Chris Hani Baragwanath Hospital. There are a number of other areas where the compliance with the fire prevention is already ongoing. There are about, all in all, there are 4 blocks in the hospital. But to do all those, so they're going to do block by block, when they finish one block, they're going to move to the next. The team, the DPSA team, which is now taking over as a project manager, is still evaluating, but preliminarily working with our team, they gave us a timeline that we must expect full functionality by the end of next year, end of 2023. Yeah. That's their estimation currently.
Yeah, that does make sense. Do you have an estimate of costs of the full repair and how it's going to be paid?
Well, thanks to a number of good Samaritans who have come forward, the Solidarity Fund has put a lot of money. This accident and emergency unit, which is almost ready, except for the fact that it has been sabotaged, that has been funded in full by the Solidarity Fund. Also, there is an area also of storage which is also getting ready to be repaired, and that we've been told that the gift of the givers has undertaken to make a contribution in terms of that rehabilitation. But government, both national and provincial, will also be putting a lot of resources. At the current moment, what I'm aware of is that in the region of R1 billion has been already secured to undertake these repairs.
Wow.
And I'm not sure whether that will be sufficient, but I'm aware that R1 billion is already been secured between the Treasury of the province and also some contribution from the national government that should be able to take us forward.
Do we as yet have clarity on what caused this fire?
Well, what I'm informed is that we still don't have the forensic police forensic report. I think at this stage, until such time that the experts who are basically from the police give us the report, we wouldn't know. There are all sorts of speculations, whether it was deliberate, whether it was an electrical fault. There are all sorts of speculations, but even today, when I asked from the province and the hospital management, they indicated that they still haven't received the forensic police report.
Are you saying to me that there's a possibility that it might have been deliberately set fire to?
That is not excluded until such time that we get the report. As I'm saying, but this is sheer speculation. It's sheer speculation at this stage. But as you talk to people, they just, I mean, especially when you start to see the things which I'm mentioning of when the repairs have been done, now, it's such a difficult situation when there's a damage to a hospital, you commission, experts to do the repairs, And then you must also hire security to come and guard the areas which have been repaired. Because,
Minister,
so that's very...
yeah. I can't let you go without asking you about where we are with Chris Hani Baragwanath. Over the last few weeks in particular, we've heard such distressing stories that it seems supply chain management has broken down to such an extent that patients weren't getting bread. And either that's a cash flow situation or an incompetence situation where someone doesn't know how to properly run the systems of this massive, massive hospital. We're seeing that doctors and nurses actually came out to protest. They were so frustrated. Please tell me if you have got a handle on the supply chain management and the funding for big hospitals like Chris Hani, because if that falls apart, it's going to cost us so many lives. Talk to me about what is being done around Chris Hani Baragwanath Hospital, please.
As I said to you, Sally, that while we were focusing to some extent, to a large extent, on the Charlotte Maxeke Johannesburg Academic, but the reason why I spent almost a day there, we also looking at the entire province. We looked, the CFO was there, the HOD was there, the top management of the department and the MEC, and from my side, the DG, the CFO of National Department and all other. So we went through all those things, the supply chain, what are the fault lines, and having interrogated all that, we finally were, assured that this had been addressed. Some of those were, gaps in as far as where contracts lapse and they are not renewed, and also where suppliers are not paid in time, and some of these are small businesses which if you don't pay them for a whole month or 2 months, then they are not able to supply the services. So, but, after all that, we were assured, and as you might be aware, the services have been restored, including also the area of where the doctors were, and not only the doctors, but the nurses and all the healthcare workers at Chris Hani Baragwanath were very unhappy. That matter has also been addressed. It doesn't necessarily solve the long term, but in the short term, at least for the next 12 months, all the health workers whose contracts were about to be terminated will be reinstated so that they can have another 12 months extension. We still have to work with them to see what is to be done in the long term. But what we have agreed on is, a solution in terms of at least for the next 12 months.
Well, that is certainly good news. And I want to thank you for speaking to us after such a long meeting today, and for giving us the information that you have, because we are very eager to see things coming right for Charlotte Maxeke Hospital, but all the hospitals that are suffering at the moment. Thank you so much. That is our Health Minister, Dr. Joe Phaahla.